Hey guys, welcome to a second episode on this series on gynecomastia. Today we'll be speaking about how gynecomastia is treated, how we do the surgery a little differently from others, what are the different grades of gynecomastia and how it affects your treatment, and how you can know what grade of gynecomastia you have. Hi, I'm Dr. Saumil Shah. I'm a board certified plastic surgeon practicing in Borivali West in Mumbai. I'm the director of plastic surgery at Skin Zone Aesthetics. So, as we said in our previous episode, gynecomastia is like an extra sixth finger that you have. As you know, if you have a sixth finger, there is no medicines that you can take that your sixth finger will go away. There is no exercises that you can do that finger will go away. What we have to do is basically remove that finger. Not chop it off, but actually surgically remove it. That is the same thing that needs to be done for gynecomastia. No medicines, no exercises, no treatments such as external ultrasonography and all of these things really work in gynecomastia. What needs to be done is surgery to remove this gland. So now coming to what are the different grades of gynecomastia, how you can know what grade sort of you have, and how it affects our decision making in the treatment of gynecomastia. Now coming to the grades of gynecomastia, you will see things like doctors might define it as grade 1 to 4, or they might be grade 1, 2A, 2B and 3. So these are the different technicalities that are there in defining the different grades of gynecomastia. You have to understand how it matters is basically we need to know what are the different problems you have associated with gynecomastia and how it affects your treatment. So the problems that are treated in a gynecomastia is one, of course, the gland, because that is what is gynecomastia. So we have to remove your gland. Now we have to understand that because of this gland, there is also excess fat around this gland, which is very difficult to lose and which again causes a lot of people to think that that is what is gynecomastia. So the second thing we correct during gynecomastia surgery is the fat in your chest. And the third thing, in very large gynecomastia patients, which are like what we define as grade 3 and grade 4, is removing the excess skin that may be associated because of these enlarged chests. So to understand this, think of it like you've deflated a balloon. That wrinkled skin that is there sometimes does not go back if it is too large, and then you have to remove the skin as well. So in the treatment of gynecomastia, if you have just a gland, in simple terms, it would be grade 1. If you have more fat but not a lot of skin, it would be grade 2 or grade 3. And if you have a lot of skin, it is grade 4, that is the highest grade. And then we have to remove all of it. And that is how the grading of gynecomastia basically is. Okay, so coming to the surgery of gynecomastia. Now, if it is grade 1, we have to just remove the gland. We can do it in either way. We can do it under general anesthesia or we can do it under local anesthesia, where we take a small cut at the junction between your areola and your skin under local anesthesia and take this gland out in a standard manner. This incision we sort of stitch up, and in about 90 to 95% of cases, this does not really show, the scar does not really show. Now, the thing that we do differently for the upper grades of gynecomastia, where we have to include liposuction as a treatment to remove the excess fat, is that we of course do the liposuction like how everybody does, through a small 4mm incision under the side of the chest, from the side of the chest, which sort of falls under the upper part of your arm. After doing this liposuction, unlike what you might have seen other surgeons do on their videos, is where they take a small incision, again how between the areola and the skin, we do not take that incision. What we do is through this same liposuction incision, that small 4mm, 5mm incision, we take your gland out. And that is how our surgery is a little different from other surgeries. Let me explain why we have started doing this. In about those 5 to 10% of patients in whom that incision is visible, it is as traumatic for them as the gynecomastia itself. We believe that the surgery of gynecomastia should not leave behind telltale signs that the surgery has been done, because that is as mentally disabling for the young men who get this surgery done as the reason for the surgery itself. So we don't want that scarring to happen on the front of the chest. This scar on the side of the chest is not really visible from the front when you look at it. It is visible from one side. It will look like a pock mark, say after a small boil that has happened. And so it does not leave behind that sign that some surgery has been done for you. And that is the reason why we do this surgery in a manner that is a little different from how conventionally surgeons do it. That was about the surgery of gynecomastia. Do let me know if you still have some queries about how we treat gynecomastia, and I'll be very happy to answer them. Join me in my next episode where we speak about what the recovery after the gynecomastia will be, what care you will need to take, and how many days you can get back to work. The answer might surprise you.